The lungs are a pair of respiratory organs that occupy a large part of the chest region. Their function of breathing in oxygen and giving out carbon dioxide is facilitated by the diaphragm and other respiratory muscles. The air passes through a network of respiratory passages, starting from the trachea and ending at the terminal bronchioles, which open up into the alveoli. Each conical organ has an apex which faces upwards and is located at the root of the neck. The broad base sits on the dome of the diaphragm of the same side. The lateral surface is smooth and convex. It is also called the costal surface. The tracheobronchial tree is a branched tubular system of ducts that directs air from the atmosphere into the lungs. The trachea lies in front of the esophagus in the chest and divides into two principal bronchi. The right principal bronchus gives off the right superior lobar bronchus and then continues as the bronchus intermedius. The bronchus intermedius gives rise to middle and inferior lobar branches. The left principal bronchus divides into superior and inferior lobar branches. The lungs are covered by two thin layers of serous membranes, the outer or parietal pleura and the inner or visceral pleura. The parietal pleura lies in contact with the thoracic wall, diaphragm, and mediastinal structures, while the visceral pleura lies in contact with the lungs. The two layers of pleura are continuous with each other at the hilum. The parietal pleura can be divided into costal, mediastinal, diaphragmatic, and cervical parts. The thoracic viscera are supplied by the autonomic nervous system in a pattern identical to all other regions. The sympathetic ganglia are located in the cervical and thoracic part of the sympathetic chain, which extend on either side of the vertebral column, whereas the parasympathetic, contributed mainly by the vagus ganglia, are located close to or within the organs they supply. The autonomic nerves form three major plexuses in the thorax, which supply the lungs, heart, and esophagus. The thoracic lymphatic system consists of lymph nodes that are connected to each other through lymphatic vessels. These lymphatic vessels ultimately drain into the main lymphatic trunks, the thoracic duct and right lymphatic duct, which in turn open into the venous system in the thorax. Some of the lymph nodes drain the thoracic wall. These are called the parietal nodes. There are others that drain the visceral structures. The lymphatics of the thorax are particularly important since they are one of the primary routes through which cancers spread to other parts of the body. The lymph nodes in the thoracic wall include the axillary, parasternal, posterior intercostal, and diaphragmatic. The lymph nodes of the viscera are the mediastinal nodes and the pulmonary nodes.